Welcome to part two. Let's jump right back in, and I'm so excited to see where Dr. Kaitlyn is going to take us. Kind of moving into pregnancy and preparing for birth, because for me, I honestly didn't even think of seeing a pelvic floor specialist prior. I thought, okay,
Yeah.
I'm now on this pelvic floor kick. I've got it ready to go after I have my son. But like, I didn't even think, oh, I could even see one before. So,
hmm
what types of things do you want to make sure as a therapist to prepare moms for the whole
Yep.
birth side of it?
Yeah. I think a lot of it is prevention and education. So, a lot of times in that first appointment that we're seeing you during pregnancy, it's kind of gauging like, what is your knowledge? Do we know anything about the pelvic floor or do we know nothing about the pelvic floor? And if we know nothing about the pelvic floor, which is majority of the moms that we see, this is going to be a lot of time that we're going to educate about the muscles, just like kind of what we did. This is their function. This is what they do. And then we also kind of want to see what's your breathing pattern like? How are you turning on your abdominal muscles? Are you able to contract your pelvic floor? Can you relax your pelvic floor? So that also kind of brings up a point. As a pelvic floor therapist, we are trained in doing an internal exam. This internal exam is very different than what your OB or your midwife is doing. It's not a pelvic exam. We are looking at the pelvic floor muscles, and this is going to allow us to feel, are all those layers turning on? Are all those layers turning off? Are both sides doing what they need to do? Are the muscles coordinating together? What happens when you're breathing? What happens when you turn on your abdominal muscles? What happens when you're coughing? What happens when you sneeze? Do you have any tenderness in any area? Is anything painful? So it does give us a really good amount of information to figure out, okay, like what is the current state of your pelvic floor? And kind of depending on what we find out, we might treat and address those things. For some people, if they're like, I don't want to do an internal exam, I don't want to do that, there's still a lot that we can do externally, and we can palpate different things and we can feel different things so that you can still learn how those muscles need to turn on, how those muscles need to relax. We can feel those muscles over clothes, over the skin. Like if you were to stick your hand underneath your bottom and find where your two sit bones are, and then bring your fingers in and kind of curl them up and in, you're now going to be on your pelvic floor. So in sitting, you can kind of feel, okay, if I want to do a Kegel or think about squeezing those muscles and lifting, I should be able to feel something happening under my fingers. And when I'm trying to relax, I should feel that tissue being able to go down into my fingers. So there's some different techniques like that that we can also do externally so that your brain starts to figure out what these muscles are doing down there. So a lot of pelvic floor education will also talk a lot about the abdominal wall and diastasis recti. So for those of you who don't know, diastasis recti is when the two sides of the abdominal muscles start to spread apart. This does not mean that those muscles are splitting or tearing. Between those muscles, we have what's called the linea alba, this line of connective tissue. And this line is going to stretch and thin and lengthen. And that's what's going to allow these two sides to kind of stretch and open up during pregnancy. This is a normal adaptation of pregnancy. Everybody by the end is going to have some amount of separation. But what we want to make sure, though, and again, I think there's still a lot of myths about this, we still want to engage those muscles during pregnancy. So some of this is giving you good types of exercises to do to keep those muscles strong and turning them on. Because think about it, if your pelvic floor is just like any other muscle, okay, let's take your quads, for example. Say for 9 months, I said, don't do anything with your quads. Don't walk, don't squat, do nothing. And then we're going to have 6 weeks and we're going to completely rest. And now you want to go back to running. Like your quads wouldn't know what to do or how to work. So those muscles, and again, there's going to be, I like to say there might be more beneficial exercises and less beneficial exercises, but I want to try to minimize the safe and unsafe terminology. I think that just elicits a lot of fear in moms, and there's really nothing safe or unsafe about it. It's more beneficial or not beneficial. Like if your OB and midwife said that you could exercise, you don't have any precautions, there's not like a medical reason for you not to exercise, you turning on these muscles and doing some specific core exercises is going to be beneficial long term. Okay. So again, we'll talk a lot about diastasis recti, again, what it is, what it's not, how we can keep turning on those muscles. And as you continue to progress in pregnancy, as those muscles continue to separate further, those exercises are going to shift and change, and how we do them is going to to be a little bit different because now your body has changed as well. And then we talk a lot about what are things that we can do to just keep your body feeling good in hopes to minimize the back pain and the hip pain. So a lot of that is keeping everything around your pelvis. So we can think abs, hips, glutes, pelvic floor, all those things. We want to keep them strong, stable, in balance so that we're not getting pubic bone discomfort or SI joint discomfort. And I think a lot of moms who I see kind of the second and the third time around, once they've been through it once, they're like, I never want to have that pubic bone pain again. What can I do to prevent this? And the good thing is there's a lot of things that we can do. It's knowing the right strengthening. But I think at this point, we all know about relaxin. It kind of makes those joints nice and loose. So that just means our muscles need to work even harder to keep everything nice and stable and happy. So strength training is key during pregnancy. And this doesn't mean you have to go to the gym and lift really heavy weights, but we need to be activating those muscles through pregnancy more than just going on walks. And even though walking is great, and I also recommend doing that, doing these targeted exercises is just going to help our bodies feel great through pregnancy. Then once we're getting towards the end of pregnancy, we start thinking about birth prep. Okay. So just like we mentioned before, pelvic floor muscles, we need strength and we need to lengthen and relax. For birth, I always say these muscles are like a gate. We need the gate to open in order to let the baby's head come out. So technically, I don't need my pelvic floor muscles to be strong for birth. I need them to be strong and functional for pregnancy, so I'm not having some of these issues. But specifically for birth, these muscles, again, need to relax and lengthen and get out of the way. And so for a lot of moms too, it is hard to relax those muscles and even feel what it feels like to relax. Especially, I feel like when I was in Arizona, I worked with a lot of moms who very type A, super athletic, like there was just a lot of tension down in their pelvic floor that they almost couldn't feel then how to get their pelvic floor from this already tightened state to relax. Like I can feel how to squeeze my muscle, but I don't know how to let it go. And that letting go is really, really important for pushing. So again, if you kind of resonate with that, we want to work on that relaxation. And we can do that through breathing techniques. We can do that through stretching. We can do different hip stretches. We can do different internal techniques during pregnancy if that's something that you're open to. So there's a lot of different strategies that we can do to get these muscles to relax and let go. And some of it is consistency. Doing these different birth prep types of exercises will help those muscles to relax. We'll also go through different breathing techniques, different pushing techniques. And I say it's all related to pelvic floor. It's the pelvic floor birth prep. So still go to your hospital birth class or any of the other birth classes that will take you through kind of what you should expect birth to look like from their perspective. But we just specifically talk about how we can best support your pelvic floor, how we can minimize any tearing, how we can help you feel what that pushing sensation feels like. That's another thing. And I think we might have talked about this prior is like, when you go to push, it's just a very unique sensation. I think a lot of times we try to like squeeze in order to push, when in reality, we need to like lengthen and push out. So the best kind of analogy that I have come up with is I think a lot of times you'll hear push like you're trying to poop. And yes, our muscles are lengthening when we're pooping, but we need the other hole to lengthen as well. So I like to say, imagine you've got a tampon in that vaginal opening. You're trying to push that tampon out. That's that letting go, that lengthening sensation. And obviously, you're going to need to provide more force and push behind it. But feeling what that lengthening sensation feels like, then we can kind of work with our breath to also get that breath and that lengthen push, so that when it comes time for pushing, we are effective and we are efficient in our pushes. We've practiced it before. You know what it should feels like. So when you're in the moment, you're like, okay, I got this, versus getting to the end of your prayer or the end of your labor being like, I'm exhausted and now I don't know how to push this baby out of me. Like, we've been there, we've talked about it, we've gone through these different scenarios, can be really, really helpful. And I always like to add, birth is unpredictable, right? There's only so much that we can do to prepare. And once we go through all these birth prep appointments and we've done everything that you can do, rest assured that you've literally done everything that you can do. And how that baby comes out they're going to come out into the world. That doesn't mean that you should have done more or should have done something else. Like, it does come down to trusting your team. Make sure you love your OB and your midwife and you're aligned so that we can hopefully get kind of that birth that you want. But just recognize sometimes things happen that are completely out of your control. And I know that's sometimes really hard to hear. But the beauty of it is, no matter how your baby came into the world, that is where a pelvic floor PT, we get to help you recover. So whether you had a vaginal delivery, whether you had a C-section, we know so much more about rehab and recovery now that we can really have a positive experience when you are working with a PT who can guide you through what that recovery will look like.
I think that's so great. There are so many amazing things that you just said and touched on. And I wish going back, and I'm grateful that like I at least found you during my pregnancy to be like, oh, and this is a huge shout out to you. Like, your Instagram is so knowledgeable on just being able to like teach women what's actually happening. And that is so great from like my perspective, because I had no idea. And you get thrown so many things when you're pregnant, and I have no idea what's going on. And for me, one of the things you touched on was what's safe and not safe during pregnancy. And I was so confused all the time. I thought, okay, well, I'm an athlete prior to having kids, and being told not to do anything, that was really hard. I never explicitly had anyone say like, you can't do this, but you hear all these myths and rumors and you're like, wait, what can I do? So I love that you're educating women what's beneficial and maybe not beneficial for birth, for pre having your child, and then even after, creating like very specific things to help the mother in her healing process, which I think is phenomenal.
And I think too, everyone is coming from a different place of, I want to be really active, I don't really want to do anything. So again, I want to support you in wherever you are in the spectrum of things, but also be able to give you those tools and resources so that you can be successful. Whether we want to keep doing what we were doing, we want to keep running, we want to keep lifting, we want to keep staying really active, or maybe I really haven't worked out as much as I should. Okay, where's a really good starting point that we can still give you some things to work on to keep your body feeling good? Because let's be honest, pregnancy is long. It is 9 months. We want to try to make this as enjoyable as possible, and we can really set ourselves up for success when we're adding in these exercises that can be so beneficial for us. But I think as more and more research is coming out, there's more and more that it is getting known. I think we're able to dispel a lot of the myths. The tricky thing is I feel like getting that research then out to everybody is hard, because of course, everyone I follow on social media is all like other pelvic floor PTs and fitness influencers and things like that. And I think a good marketing tactic is the safe and unsafe thing. So I get that from a marketing standpoint, but it really does induce that fear in a mom of like, oh, if this isn't safe, is this hurting my body? Is this hurting my baby's body? Like, again, it just brings up that negativity around movement, when in reality, we want it to be more beneficial and more positive. And that's where I really like working with someone one-on-one, whether that's in person or virtually, so that you can get care that's really tailored towards you. Obviously, that's going to be the best case scenario. But I think too, there's a lot of us out here who are trying to educate the general public on generally good things that we should do or good things that we should learn. But always kind of realize in the back of your mind that best case scenario, you're getting that individual one-on-one care that you deserve. But yes, if I can give a plethora of resources as quick as possible on social media, I will happily continue to do that.
I didn't prepare you for this one, but it just came to my mind because I was just thinking about it, and I'm thinking, okay, I'm a mom listening and this is all great and awesome, but what if I had a C-section and I didn't actually push the baby out of me? Are you still able to help with all of that healing process as well?
You bet. So remember, just because you are pregnant, your pelvic floor is affected. So even if you had a C-section, all those pelvic floor issues, leaking, heaviness, pain with sex, back pain, hip pain, you might still experience all those things. When it comes to a C-section, the recovery is going to be a little bit different. And think about, obviously, a C-section is major abdominal surgery. Most PTs work with people after they have surgery. So it should be an automatic thing. If you had a C-section, you're going to see a PT. The wild thing to me is though moms are still given such minimal instruction in the hospital. It's like, you have this giant wound and oh yeah, here's your baby. Good luck. We'll see you in 6 weeks. It's like, what do I do with the incision? How do I hold my baby? How do I get out of bed? How do I get in my car? How do I get dressed? Like, those are basic things that a PT can help you with. So what I've started to do is in my prenatal appointments, that last appointment that I see you after we do all the birth prep stuff, is we'll talk about postpartum recovery. If you have a vaginal delivery, if you have a C-section, some of the really basics of getting in and out of bed, holding your baby. If you have an incision, this is what to do in the first few days. These are signs to watch out for. And I think we do get that, don't lift anything more than your baby, watch out for signs of infection. This is how to keep it clean. But there's still so much more healing that we can do in that early postpartum phase, like some desensitization of the tissue around it and the nerves, so that tissue, the sensation kind of comes back, and we're not getting sensation that's too sensitive and that burning, searing, uncomfortable sorts of pain. That input with the desensitization can be really helpful early on, so that feeling starts to come back. Then we progress more into the massage and the mobilization as you continue to progress. But we want that tissue to be able to move just like anywhere else in your body. And because of all the multiple layers that are cut through to get to your baby, all of that needs to move and glide and slide really well, so that it's not going to affect things down the line. Things that it can affect, which I think a lot of people are surprised to know, is first your abdominal muscle function. So obviously there's kind of that interruption from that incision there. So it does make it harder to kind of turn on those muscles and engage them and feel what that feels like. And again, the more that we're working on that tissue in the area, the better you're going to be able to turn on those muscles. It can also affect your sensations of feeling the urge to need to go to the bathroom. It might make it less, like you might not notice as much that you have to go to the bathroom. Sometimes it can go the other way. You can feel that urge all the time and feel like I'm constantly going to the bathroom, but nothing is really coming out. Again, it's the nerves and the pressure in the bladder, and all of that is affecting those signals that are getting inputted into your body. Pain with sex, a lot of times that incision can create discomfort just by where it is in relation to the pelvic floor. So I think there's a lot that goes into that C-section recovery that we don't always connect the dots. But again, if you can see someone early on to kind of walk you through all those steps, again, it'll really help to set you up for success. So definitely, no matter how your baby comes into the world, go see pelvic floor PT, get some help. There's also, again, if PTs aren't available to you, I know there's a lot of us that do work virtually. There are a lot of quality courses that you can find online. Just make sure that you're getting it from a reputable source, someone that has credentials, qualifications to be educating you on it. Because right now it is really easy to chat GPT a C-section recovery guide and have them spit out a bunch of information. So you could get your information from anywhere, but just really try to make sure that you're getting it from qualified people. I've also had a few moms who have done programs like that, but still were unsure. Like, am I pressing hard enough? Am I not pressing hard enough? Am I doing it right? And let's just take the guesswork out of it. Working with someone in person is going to allow you to be like, okay, I'm doing what I need to do at the right step. Like, you've got enough things to worry about as a mom. Like, let me just take that off your plate for you to make this as easy as possible.
I know that there'll be a lot of moms out there that are finally like, okay, maybe I can make the step to go see a pelvic floor specialist, because I had pretty smooth births, I would say, but there was like little things that I thought, oh, I definitely want to make sure that this is all right. And you're totally right. It totally took the weight off my shoulders of the guessing game, or the like going through the list of is this, or waiting in line to see a doctor, and just seeing a pelvic floor specialist in person was so nice, because I could be like, just fix me or tell me what I need to do. And it was so great because, like you said earlier, I had no idea about the breathing. I thought pushing for my first was going to be really great, because I thought I had a really strong core, when turns out like there were so many other factors that went into pushing other than just pushing as hard as I possibly could. So it was really great to start educating myself to prepare for my second, to be like, okay, these are other things. And now even postpartum, actually learning how to breathe. And it's funny you brought that up. I was talking to my sister, and she doesn't have any kids and she's not pregnant or anything, but she was going to see a PT for her back. And he was like, why don't we start with just your breathing? Like, how are you breathing? And she thought, what do you mean? How am I breathing? Why does
I
that
just
matter?
breathe.
I know. And she was telling me about it. And I thought, oh my goodness, that's what I'm doing for my like recovery right now. And she thought, like, really? I can't believe that that was a part of it. But it's amazing how many of us like don't know how to breathe properly. And I was
Mhm.
one of them.
And the other side of things is breathing is also really connected into our nervous system regulation. So a lot of times when we're breathing these short and shallow breaths all day, it's kind of keeping us in this sympathetic flight or fight nervous system. So sometimes when people are dealing with back pain or other issues too, focusing on the breathing isn't only going to kind of like mechanically help things, but it'll also help to calm our nervous system and relax us and bring us into that resting, healing state. So I honestly say if people would learn how to breathe and drink water, like most of our issues would be gone in this world because it is just that important.
I love that. I need to make sure I'm always, I check in with myself like daily, especially in like the tense moments of
Yes.
two little boys
Yes.
where I'm like, okay, I feel like I'm here and
Mm-hmm.
tense and
Mm-hmm.
I need to just calm down, go drink a huge glass of water and like
Yeah.
take a few
Take
breaths
a few
and then
deep
come back
breaths.
in.
Exactly. I love it.
Well, I want to ask this question right before I have one last one and then we'll do
Yes.
some Q&As after.
Perfect.
But this is kind of switching gears, but I think
Mm-hmm.
it's so important because there are so many working moms out there, moms who are working for other businesses or who are running their own business while also being a mother, which is like you're just working a million jobs right there.
Yes.
So, how did you decide one that you wanted to start a business and how do you balance or how maybe some advice to give to other moms that are trying to figure out and trying to navigate how do I be a mom, but also how do I devote time for my passions and my business as well?
Yep. I think it's an ever evolving evolution. Like, I definitely don't have it figured out. And if someone says they have it figured out, let me know because I could also use some advice. But I can just kind of go based off my experience. I think early on I realized that like I can't do it all. I tried to do it all, but I can't do it all. And someone gave me this analogy. It's like in life you have these glass balls and you've got some plastic balls. And this is like the glass balls are the important things. I need to make sure that those don't drop and those don't break. And figuring out like what are those things? It's my husband, it's my kids and my family. Like I need to make sure I'm taking care of them. Sometimes my plastic balls, those are going to be more things in my business. Like, is this something urgent that I need to address right now, or can I get to that a little bit later? And I kind of apply that to everything in my life. Like, it's hard to go on Instagram and see these like beautifully decorated houses and these homemade crafts and homemade food and like perfect bodies. Like we can't do everything. And so like I value exercising and working out. That's something that's important to me. It's part of my job. But if you come into my house, like it's not perfectly organized. I'm not that Pinterest mom who does those really cute crafts with her kids. Like there's going to be things that you're like she might need to clean her house a little bit more organized. Like there's things that I recognize I can let that go. And I think it's hard. I like to call myself a recovering type A. Like I am just a little type A. I like things being a certain way. And so it's hard to let those things go. And I can't give 110% to everything, but it's not possible. And so some weeks it's like, I really need to focus on my family more, especially like when we moved and my girls were getting adjusted. That is where more of my time and attention were going. And some of the business things I had to slow down on. Maybe I didn't post as consistently. Maybe I wasn't trying to market as much. Like I kind of figured out what can I take a back seat on while I'm getting my family situated. And then once I felt like my family and my girls were getting in the rhythm, okay, I have a little bit more time to kind of work on these business side of things. So I feel like it's an ever evolving, constantly juggling like what's my priority today? What do I really need to get done? And what are kind of like secondary priorities of things that I can put on a later time, a later date, because we all only have so many hours in a day, right? And I think it's sometimes it's hard to prioritize what I'm going to pick and choose, but just thinking of what and someone else I know, sorry, I'm kind of all over the place here. Like, what are your family values? What are the things that you value? And learning also how to say no to things that aren't fitting into your values. I think that probably of everything I just said, that would probably be the one piece of advice, is like learning when it is going to be best to say no to things. Like I've really tried to be particular about the activities and sports that my girls are in. They're 5 and 3. They're still young. Like, yes, I want them to be in activities, but I don't want them to be doing something every single day of the week, because that's going to be stress for me. And I don't have time for that. So I'm like, we're going to do 1 or 2 activities for now, and then maybe we'll reassess next year and see how things look. But again, just really trying to figure out what I can say yes to and what I can say no to, and what that attempt of balance will look like.
Those are great pieces of advice. And one's even like, for me, I'm not a working mom currently, but just a reminder to like prioritize. I love that, the family values and the glass balls, because I feel like I can get overwhelmed with so many things that are going on in my life. But just a reminder to check in and be like, okay, what's important and what's not? And also like, how am I doing? So I love that. I think that those are all really great pieces. I want to last ask you, in this wild journey of motherhood, how have you grown as a woman?
I think this also goes back to my type A-ness. I think I have really learned how to adapt and adjust and change kind of based on that situation that I'm in. I think prior to being a mom, like I liked to control my days and what we eat and when I worked out, and I liked having everything in a certain way. And then I became a mom, and like, you just can't do that. Like, you can't control everything. As much as we try to get our kids on a schedule or get them to do certain things, like a lot of it is just outside of our control. And I think there is also a beauty in that relinquishing of control, of just rolling with things and seeing what happens and being able to adapt and being able to adjust. So I think I've trying to continually have that adaptability and that changing nature. And again, it's something that I will continue to probably foster as my kids continue to get older too. I know there will continue to be adapting and changing in motherhood, in my business, but not being as rigid of things need to go this certain way. We can adjust and adapt as we go.
I love that. That is such a great response, and something I am working on as well.
Especially like, I think you can look in the future too and be like, I have these big goals for my business and what I want things to look like. And I do think it's great to have goals. I think it's great to have things to reach to. But I also think it's great to recognize when we need to pivot, when we need to change, when we need to kind of modify some of those goals. So I think just kind of keeping that all in perspective is helpful for me.
I feel the same way. I know there's a time and a season. Like, there's a time and a season for everything. And I love it. That's so great. I want to say a special thank you to Dr. Kaitlyn Kakar and her education around the pelvic floor. I know many women are going to be so grateful, including me, on what I have learned from her. Be sure to listen to part 3. It's a Q&A, and all the questions are ones that you sent in. I am so excited for you to listen, and thank you again to Dr. Kaitlyn. It was so great to sit and chat with her. Let's grow wild.